Hi, my name is Ario Koshpin. I'm the founder of Perlenium Medical Technologies. Perlenium is a global manufacturer of hyaluronic acid dermal filler products. Our goal is really to become the best dermal filler company in the business.
We have a couple of things that are unique in our pipeline. We optimize the cross-linking very well. We're going to give you a stable product, but a safe product. We use a high molecular weight HA chain. We actually generate smooth and spherical products that mimics the HA that is in the human body.
My name is Kasha Gagnon and I'm the president of Perlenium. One of the benefits that we have of being boutique, this allows us to be agile. Ario and I grew up together. We went to the same high school. Because we have such a good working relationship, this allows us to really make sure that the best ideas move forward. A couple of years ago, we talked to some doctors and they said, what you're really missing is something thick. From that conversation to having a product made, to having it tested was 2 months. We can really pivot to the needs of individual accounts.
My name is Dr. Keith Burke. I'm the medical director of Perlenium Medical Technologies. So one of the unique differences about Perlenium, the company has one focus. They're creative, they're progressive, young, and has the ability to respond to the market much more rapidly.
Business is connection, the relationships that you have. That type of feedback is how we've gotten our product to the gold standard in the business. And if there's an issue with the product or we need something new, we can move. We can give doctors service that nobody else can. We know more about these products than any other company because we're making it right here. Dermal fillers is all we do. The heart and soul of this business, and it's what we've been working on for the past 20 years.
I'd like to welcome everyone to our session today on panfacial rejuvenation. Thank you very much to Perlenium for allowing us to present to all of you and share some interesting and dynamic techniques to help with panfacial rejuvenation. Before I get started, I just did want to focus on a very important message that actually comes from the heart. I want to just tell Perlenium how proud I am that something that's been grown here at home in Canada has done so well over these last few years, especially with their incredible growth, how they have achieved something that is almost unachievable, which is FDA clearance for North American made filler product, which is an exception in the industry. So it's nice to work with exceptional people doing great things. And here's to our session today, where hopefully we can come up with some techniques and an approach that complements the wonderful products we have. So we're going to get started with the consultation process. And I think we can all agree that since the beginning of the pandemic, any of our patients who've come through have found far more complaints than they once had before. That's because the whole process of someone's self-assessment has changed from what it once was. Before, this beautiful patient Leslie's going to show us, people would just look in the mirror, show us in the mirror. And they would get to choose things that they just didn't like. I'll start there because that's what we're used to. So we'll get started, Leslie. What have you noticed? What are things that you were wondering, what can injectables do?
Aging, general aging, fine lines, losing contour and it actually dipping in certain places. So you've not got the volume there anymore. Basically sagging of the face in general. So just general aging, basically.
Sure. So in other words, would you say looking youthful is a target that you might have?
Yes, youthful is the target.
Youthful is the target. And I love that. She knows she's beautiful already, so beauty is not a target that we really need to worry about. But I think youthful is something we can achieve.
Mm-hmm.
One of your key words here was sagging. Right?
Yes, yeah,
so
for sure.
Where have you noticed the sagging? Show me.
Basically from the lower, more lower, yeah. And yeah, basically the jawline, everything seems to be going, as they say, south. Sure. As you get older. And yeah, I just want to look more youthful, a little bit here. Yeah. That's all I need.
Perfect. I like that assessment. So sometimes you can actually tell that someone has an eye for what would make sense for what they're trying to achieve. So with that focus on working on what she feels might be areas of sagging and trying to achieve a youthful appearance, she's kind of focused on the lower third of the face.
Yeah.
Is that right?
Yeah, for sure.
Now that's just the mirror. Now what has changed so much in the last year, and I think it's an important point to discuss, is now people see what they look like when they speak. I'm sure if anyone has been on a Zoom call, they would sadly admit probably that they're spending most of the time watching themselves.
Exactly.
For the longest time, I don't think any of us really knew what we look like to other people, especially when we speak or we smile or when we create emotions. So this is something that I incorporate in my consultation process. So I'll have you hold the mirror up again, and I want you to say, hi, hello, how are you?
Hi, hello, how are you?
And that's when people can see what they may look like when they're emoting or expressing. Now let's do some expressions. I want you to smile very, very wide as you can. Now, if we're to look in the camera and we have you just simply smile wide, we can immediately pick up areas that we can perhaps focus on. So there's a slight asymmetry to her smile. She pulls further on one side than the other. And there's actually a little bit more show of a few more teeth on one side than the other. Always focus on teeth. Now I'm going to have you smile, no teeth. And you can see a bit of an asymmetry in the actual nasolabial folds. And that's okay. Symmetry is not entirely achievable and shouldn't be something that we have to strive for. Now I want you to smile with your lips. With your teeth. Smile with your teeth. Smile with your lips. So we can see when she smiles with her teeth, she does slope differently on the two sides, and her lips reveal some of the natural asymmetries that she has. Still a beautiful face, but certainly some areas that we can focus on. Now, when we're talking about sagging, I like to see how people look when they say certain words. So go ahead and say, hi, hello, how are you?
Hi, hello, how are you?
My name is Leslie.
My name is Leslie.
Good. So we can see she is very expressive. And that expression actually is things that she's noticed as far as dynamic lines that we can try to help with our injectable filler approach as well. Now, you also said lower face. What's your biggest concern on the lower face?
The lines, and they're getting deeper over time. They're just going south. So everything's just going south, and it's here, the contour, the chin, the lines here, and the corners of the lips. Just everything seems to be going a little bit down instead of being a little bit plump.
Right. And I think as a case study, what we see, especially when we did some videos of what Leslie looks like as she turns her face, is we do see these different lines and these different vectors of sagging, but we also notice little things like the neck. And it would be really interesting if we could achieve with our injectables today some lift to the neck, some of that ability to just help everything even further inferiorly to the areas that we're trying to work on. So certainly a beautiful face to begin with. It would be an absolute mistake to do too much. That's not the objective here. And what's your goal? You mentioned this before.
I just want to look a little bit more youthful. I don't want to go back to being 21 or 30. I just want to go old gracefully and youthful.
Right. And this is a very important point. This is your ideal patient, and this is the patient you really want to make sure you suit your treatments towards. It's a very big deal. Realistic expectations, an achievable goal. First of all, Leslie, thank you for being here.
Thank you.
Oh, my pleasure. You wouldn't believe this. So Leslie is 54 going on 55, doing fantastically. She has done a little bit in the past as far as laser treatments goes, and she has had some injectables as well in the past. So she's not unfamiliar to this world entirely. So we're going to get started right away. And I think where I'd like to start is just set my priorities, so that once I start injecting, you can see where my goal is whenever I do any of my injections. When I look at Leslie, I want you to relax as much as possible. So the relaxation is very key. I really believe in intentionality in the injections. It's not just putting a needle in a face. You will things to happen as well. I think this is a real thing. When I look at Leslie, the first thing I think of is how can I make things go in a direction I don't want it to go. The first thing I notice is her cheeks. We've already established when I was assessing her that she wanted to focus on the lower face. But when I assess her cheeks, I realized one thing, which is it's very easy to overdo her cheeks. So placement becomes very, very important. The first landmark that I want to create is basically by watching where she volumizes on expression and where I could add filler to create a bit of a lift effect. Smile wide, please. So you can see she creates quite an excursion of tissue when she smiles up here, and relax. So the usual injections, anything anterior to the suture on the zygoma here, would not be a very good idea, especially with large boluses. Rather, my intention is to always assess if I put filler somewhere, do I create an impact somewhere else? Am I being impactful? That's how we should live our lives too, actually, is what I'm doing being impactful. Smile again and relax. So as you can see, I want to create some volume here. So I'm just feeling for that little suture, that little space, and I'm creating an X. I'll just mark that to begin with. Now, anything anteriorly, we want to be careful. I don't want to volumize, so I will not inject anteriorly. And anything posteriorly can lift. So let's make lifting a priority. Again, assess. When I press and lift, am I creating a lifting effect? And the answer is yes. If her issue is the jowling effect and the lower face sagginess as she has identified it, then this injection is very helpful to her. And in fact, it does help her infraorbital space as well. I also want to establish where creating larger volumes of filler may create a lifting effect on the face overall. So I would like to see if I can inject laterally on the face. And in her case, if you turn her face all the way, you can see that creating a little bit of volume at the preauricular space can in fact create a lifting effect on the face here. In fact, with enough of a lift here, we can really reduce the lines that she's noticing there. So I do want to create a bit of a line of volume here. Now, in the marionette area, she has noticed some sagging. So this is something patients as young as mid-20s will say is a concern for them. Can I get you to smile wide? So we know this is a shifting phenomenon. It's almost like tectonic plates. You have planes of tissue that slide, insert, and overlap. And where they don't overlap, they create a breakage plane. Now I want to see, and relax, if I inject here, am I influencing that? Smile wide. It does help, in fact. And relax. So the usual areas, the usual plan of attack, which some would say is just fill this and this, simply does not do enough. We do need to create volume and lift, and then we could start attacking our other areas. Now, when she looks ahead, one of the things that I see that takes away from the youthful look is the squaring of the chin. Now, when we look at her chin, we see she actually has a different angle on either side from the midpoint of her chin. So I think anything we do to create some symmetry, especially to that lower lip, which does somewhat go up, versus the left lower lip, would be a good thing. So I can use my filler to perhaps give her a roll down on her lower lip while creating more of a pretty and youthful chin shape. And turn all the way. And of course, if we respect the profile we wish to create, this chin turning over, the recrudescence of the chin, where it just wants to go all the way up and around, this is something that can age us all. So whatever I can do to create a chin that has a more complementary line to her entire profile is a very youthful target. So chin will be important as well. Now I would like to do a little bit of direct chin filler here. So I'll just mark where I'd like to go there. And I would like to create a bit of support to her mental crease. That's probably doing some filler at the mid-mental, along the mental crease, while also injecting from this point all the way down so that we actually have some turning of the chin downwards. The beauty of the products that we have in the Prolenium line is it allows us to create that shift, that support, so that the tissue can go to where I want it to go. And I think if we create symmetry to the lip, just by doing that, we've achieved a lot. Now, when I look at the two sides and I compare, I do notice that, and as she had noticed as well, there's almost an indentation that's more noticeable on one side versus the other. Did you notice that?
Yeah, it's more this side.
Yeah. So I'd like to do something to support her. Now, how I'd do this is turn your face, please, and smile wide. Relax. I still feel that supporting the tissue under the skin, so this is beyond just creating a volume of tissue in the plane preauricularly. I do want to create bite hard for me. Along the anterior border of the masseter, I want to create an insertion where I'm using cannula to create support that would then lift and pull. Again, we're being lateral to the points of volumization. We're working on points of lifting. So I want to create that from the anterior belly of the masseter. And turn your face all the way. And she'll want to create some volume here. So when I do that, I'll probably have a little more volume that I use on this side than that side, because as she'd said quite clearly, she does notice that she indents a bit more on one side. Lips, what do you think?
Just a little bit of perkiness and hydration, maybe.
Yeah.
Just like the borderline and just a little bit of fullness.
Right.
Yeah.
So we had a bit of a discussion before, and this apprehension is a very important point to respect. We can have all the ideas in our mind, and we could think, oh, let's just do what we think is needed. But I think working within the constraints of what you see as someone who's apprehensive about having too large a lip, which I agree would not be appropriate, we can create hydration, a border, some structure, and I do truly love the outline product for the lips. It's in fact been something that I find myself almost reflexively reaching for, so you'll be okay. Right? Now, I'm going to turn her head again. Now, the last areas in the lower face that I want to focus on are the marionette and the actual jawline. This jowling is a very important point, and there's a very important principle we must all remember, which is don't inject into a problem. Too often, whether it's my hand or other hands who are injecting someone's face, we can aggravate a problem by putting material where we didn't mean to, or we thought it would help, but it made things worse. So my objective here is to create a little triangle which outlines her marionette. And I want to outline where she's having her jowling. And we can see we have a pretty good show here. Now, I'd probably want to start or inject well anteriorly to the belly of the anterior belly of the masseter, right at the apex of where I think her jowling is worse. And do not inject the material here, but from here I can access all of these points, and I can very carefully direct the pressure of my thenar eminence on the plunger to create volume where I want. And you carefully modulate. It's not the exact amount of volume on the entire area, because you respect that this in itself is a triangle. You could almost see a shadow that's created here. So that's the shadow I want to create some support to. Now, smile wide. This is key. She has a lovely smile. So anything that volumizes centrally will be exaggerating things I don't want to exaggerate. I don't want to exaggerate these cheeks. And again, don't create a problem she doesn't have. She has supreme infraorbital space. We don't want to create volume, which would suddenly become a big bag under her eyes. But I want to create support under her tissue, because I feel if we give a little support to that tissue underneath, we're improving her nasolabial folds, which, by the way, if we do a good enough job, we're actually helping a lot down here as well. So you see a whole line here that's influenced simply by giving the appropriate level of support. let us look at energy and powers and emotions. I want to give her eyes, open your eyes wide. She has a lot of energy in her eyes.
Yeah.
And it would be important because this is the judgment of the work that we do. Have we done something to bring out the energy in someone's eyes or in their expression? I want to do something to brighten that up. And again, it's the energy around the mouth, because energy around the mouth, if it's not channeled appropriately, is tension. It's pursing. It's concern. It's consternation. It's all of those things we don't want. We want to be cool as a cucumber. We want to have a poker face on all the time. And we want to look relaxed, right? Mm-hmm. So I think we can achieve all of that with this plan. And I think you're great. Are you ready?
I'm ready.
Let's get going.
Let's rock and roll.
Good.
The rheology of products is the most important part of the decision-making process. To begin with, I'll discuss why I've chosen Shape for Cheek Lift. This product is uniquely formulated to maximize lift and projection. It contains large particles and is the only volumizer in the line without additional linear HA. This means the particles are stiffer and will retain their shape after being pushed through a needle, which is quite ideal for cheek augmentation.
And the idea is to target this area on the zygoma. It's very important to make it a willful withdrawal. You okay for pain?
Mm-hmm.
Now I've created a bolus of 0.2. We can see already, if we look forward, we have achieved something. We've achieved some support in the infraorbital space. We have actually achieved some improvement to the nasolabial fold. And dare I say, I think we're actually starting to help a little bit here. Smile wide. She loves that. She loves it. And relax. So I really love where I chose. Now, if we turn her face all the way, my favorite thing is we actually see that we've created a line that's very appropriate with her cheek as it was. We haven't created a distortion. And look forward. And smile wide. And she still has a very natural smile. Now look to the side again. And smile wide. We've relaxed the number of lines that she has when she creases up when she smiles. And this was something she was hard about before in the consultation process. So once again, the objective is to touch and feel. So I'm going to touch, smile wide. I can feel the muscles move. Relax. Smile. Oh, no muscles moving. And then I could feel that suture point. So I'd love to circle that. And that becomes my target. Turn your head. And smile. Relax. And always question where you've laid down your mark. Sometimes you could convince yourself of anatomy that's not there. You okay? Mm-hmm. Make an intentional withdrawal and hold it. And inject. Slow and steady. So we have used 0.4. So that's 0.2 on each side of shape. Very nice. Now, let's actually test ourselves. Let's test our work. Look forward, please. Now, again, I love this line I've created. We have a very nice straight line. We have a very nice reflection. And we're helping her out here. My next area of focus will now be the lower face. Again, my intention is a few. I would like to help with the uneven angles on the chin itself. I would like to create a less square chin. That square chin is something that happens as we age. I want that to go away and become more youthful, more feminine, while also working on turning out the chin unit itself. let's begin. My marking for this point is very simple. We establish a midpoint going from the middle of the lip all the way down. And then we check the two sides. We can see there's an angle here that's very different than the squaring effect on this side. So there's almost a square look here, square, and it's almost rounder here. How do I neutralize this? I feel the best way to neutralize this is to create a bulk effect at the center of the chin, while respecting and anticipating the profile that we want to create. So if I inject too high up here, well, I've only aggravated the problem of a chin that's rolling up. If I inject too far down here, I'm starting to become unsafe. I need to create the volume right at the anterior, inferior border of the chin so that there's actually a rolling out, with a secondary aim of working on her lower lip.
Next, you'll notice I've chosen outline for chin. This product was originally created to provide definition in the lips. It can also be used to define other areas of the face, such as the chin. It provides nice projection while still maintaining a softness required for the female anatomy.
So you'll notice I'm not using my thumb to inject. I'm injecting with my non-thumb. Now some of you might not wonder, what does that mean? Non-thumb. Non-thumb means anything but the thumb. I inject here. So if you're to look at my hand, I'm using the plunger resting in here. And get used to the feeling of the product. I love the feeling of this product. Something that forces me to inject slowly is forcing me to think and to be safe. Are you okay?
Yes, I'm fine.
Did you feel any of that?
Not really.
Beautiful. Now, what have I achieved? That concern I had of the asymmetry to her chin, I've helped that quite a bit. Turn your face all the way. I love the angle that I've chosen to inject because I haven't worsened that rolling up effect on her chin. My choice of product feels very appropriate because I wonder if I've even helped with her right lower lip asymmetry by pulling things down due to the support that I've created in her chin. I do feel that this has even improved a little bit by creating some distance from chin to the fold. Look. Now I'm perhaps seeing just a little bit of asymmetry that I'm not quite happy with, and I can adjust for that by my injections into the mental fold. My next injection will be into the mental fold. So if I'm to actually establish where these lines are, it's where this crease wants to be created by the chin. Now what's interesting is by helping support her chin, we've already made this much better. This is very youthful. So we're going to start with mental fold. The next injection point that I'd like to focus on is to further help enhance her lower face. So for the chin, I want to exaggerate the mental crease by folding, drawing around where that line is when I crack, and then saying, I would like to influence this by creating some filler to support that chin, but also helping with the asymmetry that she continues to have, although it's improved by the filler that I had done, and perhaps apportioning a bit of a volume of filler on one side more than the other. You okay?
Mm-hmm.
So we're going to get started. And you can see we are trying to have a little more volume on one side versus the other. and support that mental crease.
As you can see, I've chosen Contour to work on the mental crease. You will also see that it's my choice of product for the marionette lines. Contour is the most malleable of the Rejuvenation volumizers. It contains enough linear HA to provide a softness for highly mobile regions and to not put too much pressure on the mental artery. But it also contains a high enough G' to provide structure for the marionette region. It is very critical to use something that has such properties, so the result is very natural and forgiving.
And my objective is to introduce about 0.3 cc's on this side and 0.2 cc's on the other. Again, the beauty is we're achieving quite an impact without a high volume treatment. Something we should respect for our patients' budgets. Again, the objective is to support that mental crease so that she doesn't have the tendency to roll into it. Now, one thing that you'll notice is the benefit of trying to be ambidextrous. So I'm injecting with my left hand, whereas I started with my right. And it's something you could train yourself to do. Helps, it makes a difference. You okay?
Mm-hmm.
Spicy.
Mm-hmm.
You all right?
Mm-hmm.
Beautiful. Again, the angle I'm creating is very particular. I want to have a little more support. And something very interesting has happened. That right lower lip, which was not symmetric to the other side, now is nearly symmetric. That's without any lip filler in yet. So this was actually an excellent, excellent result. Smile wide, relax. Kiss. Ooh, relax. So her tendency to create lines has been diminished quite a bit. If we are to follow and look at her lines here, we've almost helped even the jowling just by helping with the chin. Look forward. Now when we look at her chin itself, it was asymmetric and square to begin with. Right now we have a more curved chin, very feminine, and we have a chin that doesn't roll up. So there you have it. I've used the entire leftover of the syringe. We had 0.3 cc's of contour, which I used on the one side, and 0.2 cc's of contour that I've now used on the other side. This was all done in the subcutaneous plane with the intention of creating a rounder, more symmetric chin, which has helped to bring down her lip and created a gorgeous profile. We're even starting to help a little bit of this neck sagging as well. We'll go ahead and move on to the marionette line treatment. Now we call it a line, I consider it a region. So the marionette region can be defined by a few vectors, depending on who you are. Of course, I don't have all the answers. One, I like to drop it. Two, do the, Barack Obama, how he could go not bad and curl his mouth down. Look at me. There you go. She has some. Do that again. You see this. We miss this. It's very important marking. There you go. Relax. Drop it down. So this is marionette. And then not surprisingly, she has a bit of asymmetry to her lips to begin with. So her marionette region is fairly different on the two sides, but almost the same too. So we're going to make this our next target. Now it's very important, this is where rheology comes in. We want to choose products based on their ability to not draw too much water. Again, this is why I favor many of the Prolinium products. The next is tissue integration. Tissue integration is the difference between looking phony and looking natural. Because again, just as they came in because of how they looked in Zoom, they'll judge you by how you make them look in their Zoom meetings. Now my goal is to use 0.5 cc's of contour into each of my marionette areas. And I always think of my best teachers. I've learned from some incredible people. I think one of the smartest things that I was ever taught, because marionettes are challenging, was from Dr. Swift. And if you think of it as snowmen, snow women, snow people, and developing little bodies, whether or not you necessarily do it as a full-on snow person, that doesn't matter, but the idea is you respect the fact that you need a little different volume in the different areas. Now I'm actually sneaking this around the oral commissure, and I'm above, and now I'm at it. Now I'm under it. And now I develop my injection points to make snow people. And I'm creating almost a little snake, like a caduceus, the symbol of medicine. And in doing so, I am inflating, reinflating, reinvigorating this marionette in a way that suits me. Look at that. This is an incredible result with only a half syringe. Very hard to achieve. Turn your head. We'll just reproduce the same on this side. And as you can see, this is more of a true triangle. And there's a bit of a different angle that's created by my established borders of the marionette line. So again, I'm actually snaking up. And I'm doing something different. I don't know if many of you may do this or have seen this, but I'll actually start above the commissure, inject a little bit, be at the commissure, inject a little bit, be around the commissure, inject a little bit, and then I create my caduceus. Caduceus again is that slippery serpentine figure from mythology. The symbol of medicine. Did you know that, Leslie? Yeah. What do you think of Bitcoin? Just kidding. The point is, I'm trying to show how relaxed she is. She's doing just great. And again, I know the borders that I created before I even started. Whoa. Check it out. Turn your head. She had quite the significant overhang. Look forward. And she had a very deep marionette. Smile. Gorgeous. Relax. Kiss. Wonderful. Nothing to see. Whoa, your lower face, though. Your focus has been achieved.
Thank you.
One technique that I really enjoy employing is injecting at the pre-auricular space. Now with the right material, in this case I'll be using shape, I do want to create a bit of a substance and support for that lower face difficulty that she was having before. So with a little bit of filler support, I can give her a lift. The objective here would be used to 0.3 cc's of shape on either side. Simply put, my target will be to see which vector creates a lift. So I feel if I could get about a thumb space anterior, I create a lift that's very effective. So clean again, establish your anatomy, and pull. And it's very important to be gentle with your technique. Now, I'm not injecting too hard, and I'm just creating a bit of a lift and a pull. 0.3 is the target. Felt that a bit?
Mm-hmm.
So I do feel, look at that smile. Look at that smile. I do feel that we have created a bit of a pullback, and I can even proceed further, bite hard, again marking anterior to the masseter, to go ahead and do some further injections. And again, I'm going to create the same insertion point, feeling about the size of my thumb, and inserting at the preauricular jawline. Wonderful. Thank you. So I'm injecting slowly. I'm introducing my product. I'm feeling it. I'm not trying to create any pops or tears or burst through any kind of fascia. I'm just creating some subcuticular support, subcutaneous fat. And I'm slowly withdrawing with my cannula. This thread, or this bar that I'm creating, is incredible at giving a lifting capacity from the lateral space. So we're going to go ahead and do some injections at the pre-masseteric space, where I'm injecting retrograde to give a lifting effect to the lower face. Again, for me, all of the lower face work requires using foundations lateral to the actual lower face, and then working with all of the elements between as you go. Bite hard for me. Relax. So I'm just drawing a line. Bite. There you go. Relax. I'm going to just give a little wipe to where I want this spot to begin. You all right?
Mm-hmm.
Super. And my aim is to use about 0.3 cc's here. You can see as I actually create some torque with my cannula, there's a cantilever effect that I'm creating. And if you look at her marionette line, you can see at a certain angle, her marionette's disappeared with my cannula up here. So that's 0.3 cc's. And I've created, turn your head, an incredibly nice lift to the lower face. Christy, I'll get you to come put some pressure over here. And again, I'm just going to feel and massage to make sure that I like how the product is sitting. Go ahead, put some pressure. Now, if we were to compare and contrast the two sides, the undone side has an emptiness. And as she pointed out before, it was quite empty on one side. Now, we filled this side quite sufficiently, very youthful overall. We've had an incredible impact on her nasolabial folds. I may not even touch them in this session. And we know This pre-auricular injection has really helped with lifting, but on this side you have the benefit of pre-auricular and pre-masseteric injections, which create a neutralization of the hollow, which she has here. So this will be our next target. Sure. So I'm not trying to ram my needle through any of the native anatomy. That's not the point. I am trying to use some of the torque and resistance from my needle to give a lift and a pull on my cannula. You okay?
Mm-hmm.
And there you have it. 0.3 cc's in the subcutaneous at the pre-masseteric space. Our next goal is to work on the lateral inferior jawline. And the idea is to straighten out what we see as the jowling, the chin, and the space in between.
My choice of product for the jawline is shape. My rationale for this is similar to why it was chosen for the cheeks. Shape is ideal for jawline as its properties mimic that of bone. It provides results similar to that of a semi-permanent injectable with the safety profile of an HA. Prolenium actually provided safety data on this injectable, testing the dissolvability of this HA against other competing volumizers to ensure in the event of an emergency, hyaluronidase would completely break down shape faster. As you can see, it really fits the bill for this anatomical area.
Jawline contouring is very important, and the creation of it is restoration of youth. We begin by first looking at the jawline, the apex of the jawline, and saying that will be where I start my work from. But that's not where I'm going to inject. The actual injections will be anterior to the jowling. Do not inject into the problem. You're the best. You okay?
Mm-hmm.
Amazing. Again, make your life easy. Make your hands happy. Let the injections happen, not by pressing with your thumb. Still okay? And I'm creating shape as I go. We can play with this material. And again, I'm being very mindful of where my tip is. It's easy to forget where that tip is. And there you have it. This is superb. She has a near perfect jawline. And again, it's the product that sings in this area. And her jowling has diminished. Sit up, please. Let's capture her neck. I want you to notice she has nothing in the way of neck waddle. nearly nothing. I can't say nothing on this side. But if we see the untreated side, I can grab it with my thumb. It's pretty exceptional. And it feels great. You're in great shape. So the objective of choosing where you start is based around how to stay away from important vessels. Where we go with the tip of our cannula is making sure we're in a place where there can't be a big vessel. And what you do as you go, as you withdraw, is you're injecting and feeling and remembering that because it's a cannula, though you feel safe, things can still go bad. So you're feeling and you're watching. I'm watching the whole time, and I'm fearful that I could get through a large vessel at any good time. So I'm looking for color change and modeling. So never assume you're perfectly safe anywhere. You're never safe. You can run, but you can't hide from anatomy. So respect it. Beautiful. And again, turn all the way. We have a very straight jawline. How old are you again, Leslie?
54. Going
Gorgeous.
55.
Gorgeous. We've completely transformed her lower face. So her marionettes, her sag, her hollows, they've been transformed.
One of the products of choice that I defer to when it comes to lip filler is Outline. Outline is the newest product in the Rejuvenation family. It was specifically formulated to create structure and definition in the lip and surrounding regions. It is uniquely formulated with only 4% linear HA, round particles to allow for the creation of a crisp border, without worry of lumps or bumps or product migration.
The technique that I will use here is fairly superficial. I've loaded my product, which is Outline and BD syringe. Ouch. And go ahead and inject. I'm using roughly 0.05 cc's per strut or less. So we'll be using a total of 0.6. On the very last one I use much less. So it works out to about 0.15 per quadrant. And just that alone has created a definition, a border, and the look of hydration for her lips. I like to create a complementary shadow. And once I get to the edge, I let my needle sit there just for a moment, because the beauty of Outline, why I love it in lips, is it almost follows those contour on the lip roll, and it somehow just knows where to go without being told where to go. It just listens. So I love this. She was careful. She was worried about getting too much. So I'm being respectful of her concerns. Feel this will come to the pouch. We just, as you saw, the product almost just followed that border on its own. I didn't have to coax it. I just knew where to go. Again, it just follows. A very obedient product. Doesn't talk back. And it's important to remember, though, every moment that I'm doing a lip injection, I'm really looking for any blanching, any color change, any modeling discoloration. All over. Again, I lingered there a bit. And that's because that's where she's very asymmetric on her lower lip. Her biggest victory on doing her lips is the creation of symmetry, which wasn't there before. All right, so there you have it. Start to finish, this is exactly what you're looking at right after the injections. How are you feeling right now?
I'm feeling good, actually.
Good. She was quite a champ, we must say. Let's talk through what we did. I think we're going to do the final tally, but roughly we're just under 6 syringes. So this is an exceptional outcome, and that's with lips, right? So that's a very nice outcome with something that's achievable and probably within budget for many who are interested in that pan-facial rejuvenation approach. We'll just talk through everything. So we created a bit of a higher cheek where there was a lifting rather than a volumization. I did nothing to volumize, and I didn't chase lines here because you'll notice I didn't touch her marionette lines. When we turn her face all the way, her profile has gone from having the jowling and the accentuation of that shadow that was down there to actually a very straight jawline. And the chin work that we did created a superb profile for her. Even with lips, even though she was nervous about lips that came together really nicely. And look straight ahead. And we'll see there's a bit more of an establishment of symmetry to her lips. Her lips were a lot more asymmetric to begin with. When she smiled, smile wide. Smile with your teeth. And all I have on her lips, by the way, is Vaseline. There's no lipstick. There's just Vaseline, which I like to use after I do my lips. And then turn your head all the way. Again, we've really worked towards those marionette lines. Again, much improved. They're not gone, but that's okay. She wants something that's achievable, that's natural. This filling in was very important because she had an asymmetry to begin with the hollowness there. And if we look at her straight on, she can actually now give her the mirror so she could judge her outcomes.
Exciting. I'm getting nervous.
Yeah.
Oh, wow. Oh my goodness.
There you have it. Thank you, everyone, for joining in. A lot of different techniques. We had an exceptional patient. Nurse Christy was an absolutely awesome assistant, and a patient who made us look good. So thank you, Leslie.
Thank you.
Good. Thanks very much for tuning in for our actual injection session. Just to keep things going and lively and interactive, we look forward to our question and answer session. Please feel free to send them in right away, and we'll get started.
With Prolenium Medical Technologies. And with me this evening is the esteemed Dr. Zaki Taher, who just guided us through that pan-facial rejuvenation treatment on our beautiful patient. We are coming to you live from Edmonton, Alberta, Canada, for those tuning to into this webinar from around the world. And before we get started, I just want to send a quick reminder to encourage everyone to download the handout that accompanied this worksheet or workshop. It will go through product selection, amount used, and treatment areas, which will help to answer a lot of your questions. If you don't have it, please feel free to reach out to one of your local representatives. So, Dr. Taher, welcome. And wow, what a great treatment outcome. Could you walk us through a little bit about it and how many syringes you used?
For sure. Thank you for the introduction, Emma. It was an absolute pleasure to work with Leslie, and I was quite happy with the results that we were able to attain. The actual final outcome required a total of 5 syringes. The objective was to be conservative in the amount of product that was used and to be realistic in what patients' budgets may be at a time like this. The optimum result here was really focused on some functional outcomes as well. As you could see, especially around the mouth, she was able to have a very different outcome as far as how she emoted, and she created a more even outcome in the lower face, as well as with her smile and her mouth and her lips.
Yeah, that before and after where she was speaking was really impactful. We actually had a number of questions come through about your caduceus, your snake technique that you used Revanesse contour for in the marionette lines. Can you elaborate more a little bit on this technique? I know most have never seen it.
For sure. So the idea is kind of building up on the fact that the area of the marionette is so complex, and there are so many excellent injection techniques to improve this area. I found the idea behind the caduceus is, we know this as the symbol of medicine, of course, where there's the staff, and then there's the image of the serpent that goes around the staff. And the idea is producing and depositing product almost exactly in that fashion, all the way down. Now, this could be done depending on where and how the patient's defect is. Some people have a more triangular and empty defect below, and some people have such a defect above at the oral commissures. So the idea was to create that shape depending on what the patient's need is. So either it goes wider from the top all the way down, or up, or the inverse. And the nice thing about a product like the ones that we've used in the Prolenium line was it created kind of a product that sits nicely, but over time will sit naturally as well and not be a big block of product.
So are you depositing product the whole time, or creating laying boluses while you're doing it?
Right. So as far as the full pan facial approaches, some areas really lend themselves to the bolus approach. In this case, I'm actually laying some product down the entire time as I go.
Okay. Do you find with your pan facial approach, when would you choose to do a bolus versus when would you use, say, the fanning technique?
For sure. So for example, if I kind of just use the hands, and it's kind of like a mask. So I kind of do this, and I say the bolus at the mentum is very impactful, especially when someone wants to have more of a projection either through their profile or from front on. Next, we know that on the cheeks, where you can actually palpate, as you saw in my injection technique, that little space, that little suture line, you can actually find that the bolus there is highly impactful as well. And then the other area that I find the bolus is to be very impactful is in temples. Of course, that's an advanced technique, and you need to pay attention to your safe techniques as well as your anatomic localization to make sure that you're being safe.
All right, great. Okay, so I just got one other question. So the question was, I've used Revanesse Outline and I find it to be really a stiff product. What made you decide to use this product on the lips in a mature patient?
I'm glad you asked that, and actually that's quite a good question. Outline has slowly become kind of, as we inject and we become more comfortable, we find certain things we just reach for. And I found Outline to be very effective nearly universally in almost all patients. And I'd actually argue that with the right technique, this product, and the technique that I used is to use it to create a lot of good structure, but not rigidity where it's unnatural. And you must respect the whole face, of course, when you do it. So she was very ideal. And I found, to me, many other products that are meant for lips may not give her the structure that she needed. And sometimes it's amazing. You could do many syringes, but it's just not until you get to the lips, unless the lips are impactful, it's hard to see the rest. So I find Outline superb for that.
Yeah, that outcome was really impactful. Given that, we did just use a quite a budgeted approach for amount of fillers used, the lips and that whole projection made it pop. The next question is actually, Oh, here it is. What areas do you find, do you landmark the facial artery before injecting the jawline?
Yeah, so to me, landmarking involves a few ways of doing it. One, always visualize where it should be, where it otherwise should be anatomically in most patients. Next, the palpation is very important. For some patients, especially when you're earlier on, it's useful to not just palpate, to actually mark it as well. It's always good form to know where you want to avoid. And of course, it's important to still respect the fact that no matter how well you think you've done, a high-risk area still remains a high-risk area, and where normal anatomy is supposed to be may vary between the population. So as long as you're careful and respectful of anatomy and safety, you should be okay, but it's an important point.
Great. And in that area, you chose to inject Rejuvenation shape. How do you find Rejuvenation shape compared to other volumizers that you could inject into the area?
So I find shape to be quite optimal simply because it does not have the linear HA. So I don't need to guess, will it attract water? Will it look phony afterwards? So taking the guesswork is very important. But number two, it's knowing that it's a product that can act as a very stable product that gives significant sculptability, as well as rigidity, which is what I want. When you have a foundational approach, it's like building a house or building a sandcastle. And I really respect the approach that Prolenium has taken as far as the use of different concentrations of linear HA to, it's like building a sandcastle on a beach. Some parts you want to have a little bit of water. Some areas you want to keep dry and firm and stiff. It's foundational versus functional.
Got it. Actually, speaking of that and water on a beach, which we all wish we were at, most of the time, products typically cause swelling that are able to give you that sculpting approach. The patient looked fantastic in her afters, and I know some of those were taken immediately after the treatment. She had very little swelling. Is that common?
Yeah. Oh, yeah. What you saw was pretty much what I see at the bedside consistently. A very, a patient who's pleased with the results, not surprised and not guessing whether or not there will be a lot of swelling coming and going. So I find that it's a consistent product, and yeah, it's the reason panfacially, especially when you're potentially doing a lot of different areas, you can make patients feel quite confident that what you see is what you'll get.
Nice. And just for the sake of time and selfishly, this is my favorite question to ask because we are Canadian. You mentioned being proud of Prolenium as a Canadian company. Do you think that matters to your patients?
Yeah. It comes up in conversation. We're lucky enough to have patients from actually all over North America. We have American patients. We have patients from outside of our own province, and it's cool because they respect that the pedigree of that product is something that they can rely on. And I almost wish you guys were making vaccines, because then Canada would have enough vaccines probably. But but I think it's a great part of the story, and patients respect story. Their own reason to come to your clinic for help is part of their journey, their story, and to have that. I mean, I think we all respect that, from fashion to food to fine drinks. We all know that pedigree matters, and that means a lot.
I love that pedigree. That's great. So with that, on behalf of all of us at Prolenium, I want to say a huge thank you for Dr. Taher, your entire team at Lucerne, our production team this evening of Encore, and all of the participants from around the world for sharing their evenings with us. So with that, thank you very much, and we hope to see you soon.
Thank you.